Oh, welcome. All right. Well, look, it's 10:30, so we'll start. And for those who are joining us in watching the replay, I just want to welcome. But before we begin, I want to acknowledge the traditional owners of the land of which we're all gathered here today. And I know we're all in different parts of Australia, but I want to pay my respects to their elders, past, present, and emerging. So thank you very much for joining us. I know that we have a few repeat people that come back every month, and I really appreciate your support. You're always going to be welcome to these webinars, and we've got some other really great topics coming in the following months. So hi to Anne, I've got you on my list there. You're in Queensland. I'm just going to move that across there. So Success Solutions Australia, welcome. It's really wonderful to have you here. And I've got Hazel here today. Hazel is a colleague of mine, and she works in Melbourne, but she works with lots of people all over Australia, especially during COVID essentially, but that's really how businesses continued on for you too, hasn't it, Hazel?
Definitely. We definitely jumped on doing systems and creating management systems online. So everything over that period was all online, including external audit. So, yep, well and truly used to being online and doing webinars and things like that. Yeah.
Absolutely. And if you, so Hazel is a safety expert. I think she's an expert in safety anyway, and really is a really big core function. And that's why I've invited her on as a guest speaker today. So if you guys are on LinkedIn, I would highly recommend going and following Hazel, connecting with her on LinkedIn. Compliance Lab is her business, and she's also quite active on Instagram, if that's your preferred platform. She's just every day, she shows up with just fantastic, helpful
Thank you.
material. Yeah. It really is. And I've also used it in my own business as well. So what we'll do is we will start. I'm just going to quickly share my screen. So we're not going to just do a screen share for the entire time, but I just wanted to initially go through a few little things just in relation to, obviously, the NDIS practice standards, just so we can relate back. So this is a safety webinar, and it is for NDIS providers. This is just a bit of an overview of the schedule before I give an introduction to myself, if this is the first time that we've met. So we've got about 40 minutes today penciled in. We'll do quick introductions. I'll tell you who Grey Management Systems are, who myself is, and Hazel. We're then going to give a bit of an overview of the NDIS, just in relation to safety, work health safety, how it sort of is embedded there in the practice standards, and where it's not. And then we've got a Q&A with Hazel, where I'm going to ask some questions. So if you do have any safety related questions, or any OC health safety or WHS, depending on what state or territory you're in, please put them through the chat box, and I'll make sure that I can get that to Hazel as well. And then Hazel and I, we've put some resources together, some really helpful internet resources that you'll be able to go through, like templates. We'll go through that later too. I will also include a PDF copy of these slides, so you actually have those resources as well, which I will pop in the chat box in a moment when I stop my screen share. So that's a bit of an overview of what to expect over the next 40 minutes. So please use the chat box at any time. As always, questions are always welcome. There is no such thing as a silly question. Please ask it if you would like to. And you can also just direct the question to me too if you would like to remain anonymous. Just let me know. Of course, if you become disconnected, you can just rejoin the webinar again. But we will upload this to our YouTube channel so you can watch this. And please share with your colleagues or other providers that you might be connected with as well, and you think that they might find this really helpful. So just to give you a quick overview, Grey Management Systems, we've been around now for 25 years. We are a registered training organisation with the Australian Skills Quality Authority. We do deliver a diploma of quality auditing that's actually broken into more modules, because we find that not everyone wants to get the diploma, but they certainly want to learn about the different parts of what we offer. So our main focus is internal auditing, so helping people conduct internal audits in their workplace to identify those gaps in their processes and risks and things of that nature. We also have specific training around risk management, continuous improvement, as well as people management and project management too. Myself, I focus more on the NDIS side of things, so I run sessions around practice standards training, incident management, which is probably my favourite course, and I'm very passionate about incident management. And also I've got privacy and professional boundaries on the horizon. So that's my website. Please check us out. And if you ever have any questions or you get stuck, please feel free to email me, say that you've been attending my webinars, and I will be more than happy to connect with you and help you where I can. So I am Lauren Gray. I am a current practicing auditor. So I work for several certification bodies now. In the NDIS, Human Services and ISO 9001 space. I'm also obviously an educator, as I've talked about. I started out in disability when I was quite young, and then I moved into the police force, where I spent most of my career as a police detective, doing a certain areas there around child protection and things of that nature. So that's me in a nutshell, but I want to throw over to Hazel, who is the star of this workshop today, this webinar. So Hazel, please introduce yourself for everyone and give us a bit of an overview of who Compliance Lab is.
Okay, so I guess I love systems. I know it's strange, but I love the world that I work in, which is basically helping businesses with ISO certification. That is pretty much what we do most days, day in, day out. We are really fascinated about the systems we create, and we try to keep them really simple. And I think that's what makes us different to other providers in our zone. We are truly passionate about safety. So even when we're creating a quality system, for example, we will always tack on safety, just so that people make sure that they cover their safety legal requirements in their business. So that is definitely our passion for Compliance Lab.
Yep, great. Thanks very much, Hazel. All right, so let's quickly talk about some common risks in the disability sector. Now, I'm sure that you're all very well aware of these, what the issues are in your workplace, but just to sort of recap, in particular, physical injuries, I would say, is really up there. So anything to do with lifting and supporting, persons with disability, using heavy equipment such as wheelchairs and hoists, obviously stress. That is a huge issue, and it's not just stress in the disability sector, it's in all stresses areas as well. Burnout links in with that, occupational violence, slips, trips and falls, and obviously bullying and harassment. So these are some also stats that I've drawn from WorkSafe in Victoria. It is a Victorian site, however, it's still quite a good site if you, for any provider, no matter whereabouts you live, because they have some really great templates as well. So we'll move on to what the practice standard says. So obviously the practice standards are the standards that you are assessed against in order to become a registered NDIS provider. So if you've been through that audit process, you know probably these quite well. So obviously it's there in order to make sure that providers are demonstrating and providing high quality, safe services and supports to NDIS participants, people with disability. Now, the practice standards don't really go into work health safety specifically, right? We already have that legal requirement regardless of what sector we work in if we're an Australian business. However, specific to the NDIS practice standards, we know that they are very much participant focused, and they don't really consider staff and other people connected with your business, that much. However, we all know that we as providers, managers, owners of businesses, we have a legal obligation to ensure a safe workplace for all our people. And so therefore, health and safety of workers, is absolutely paramount, no matter what sector we work in. So in specific to the practice standards, obviously we've got under the core module, safe environments. This comes under provision of supports, where the objective for providers is to provide a safe environment for people with disability, and it's appropriate to their needs as well. So how do we do that? We need to ensure a safe support delivery environment in participants' homes. So that could be through risk assessments, identifying risks, working out strategies of how to treat them. And then when we work with other providers and services, we also need to do some risk assessments. We also need to ensure that we are creating and maintaining safe working environments in order to prevent and manage injuries. So not only with participants, but this should also flow on to our staff and other people as well. Then in risk management, work health safety pops up as well. Obviously, the outcome of the risk management standard is really to ensure that risks to participants, workers and the provider are identified and managed appropriately. And so part of this, they specifically say this includes your work health and safety risks. So, part of that is to find the hazard. Let's assess the risk. Is it low? Is it medium? Is it high? What can we create in order to control that risk in our workplace? And let's monitor and review it, and obviously make changes if it's not working, and that's okay. If you want to know more about risk management, I've got a risk expert on next week. Steve Robbins, not next week, next month, who we're actually going to do a bit of a deep dive into risk management. And we're actually going to look at some practical templates, risk assessments at that service delivery, that frontline level, as well as that sort of higher organizational governance level as well. So that brings us, and of course, COVID-19. It wouldn't be a safety webinar without mentioning COVID-19, of course. And there's a requirement there on providers. They must implement control measures. So strategies in order to minimise the spread of COVID-19 and to ensure the health and safety of your workers and participants. And that's obviously a requirement under, the work health safety laws, as it is for all other Australian businesses and pretty much everyone else in the world at the minute. So that brings us now to, let's stop the shares. So now, Hazel, I've got some questions for you. So please, as before, if anyone has any questions, I'm just going to, before I do that, I'm going to pop in our presentation today in the chat box, if I can manage that. I'm not sure if I can actually. Otherwise, I'll just email it to everyone. But Hazel, I'll just bring up my questions. So let's talk about some of the common work health safety, laws for Australian businesses, and I'm sort of tying that back to the disability sector. So let's talk about the basics. So whether we've got a new provider or an organisation that's very well established, what are some of those mandatory requirements that people absolutely have to nail and get right?
Okay, so I guess as you've mentioned, the law clearly states that businesses have a primary duty of care for safety. Businesses must look at what their workers are doing and ensure that even people such as visitors are safe. This includes having systems and practices in your workplace to make sure that you're monitoring and evaluating safety. As an employer, it doesn't matter where your employee is working. It could be in an office, on a site, it could be in someone's home, it can be at your home, and it could be where you've got people driving on the road as well. So essentially, you need to ensure as an employer that you are covering all the risks associated with your employees.
Absolutely. And so what type of processes are you talking about? Like, what should they be looking at? Is it just a policy? Is it a simple procedure? What would it look like?
Look, of course, we all need to have a safety policy, but I think what we need is processes that support that policy. So things like, how do you manage your risks in your business? Do you know what are high risks are in your business, and how are you controlling those risks? Incident management, which you've covered as well. And that, even across all the sectors we work in, that is something people don't do well, and they're not aware of things like what is a notifiable incident. If someone ends up in hospital, are you meant to let the regulatory body know? All those types of things are things you should have defined in your business. When there is an incident, what do you do and how do you manage it? And then the next one that I think is a big gap is induction and onboarding staff members, new staff members. But even that training piece, how do you train your staff? How do you ensure that they know what they need to be doing? That piece must be covered. And also when you're doing inductions, it's all good and well to do them. Documenting them is one of the big pieces we see missing. So that's a big focus. Emergency management. So what do you do when there is an emergency? Have you defined those situations for your staff members, even if they are people who are going into people's homes? What are your approach in terms of if something goes terribly wrong in an emergency for them? Those need to be defined as well. And I guess another huge piece, across any industry is communication and consultation, and having staff involved in building these processes and being aware of what they are and what you've defined as your business.
Absolutely. And I know when I've interviewed staff during an audit and I want to talk to them about a certain procedure, maybe it's around evacuation of a residential house.
Yeah.
And they're like, this actually doesn't make sense. It's not even applicable for this property or whatever it is,
Oh,
and
yes,
there's
it
been
is. Yeah.
yeah, or but there's been that lack of, communication, not actually hearing from staff or someone actually going out there and seeing what their people are doing and how they can also input into that process to make it actually, appropriate for them. So yeah, no, that's a big one. So part of that is because some providers, might they be in the community, they might be taking groups in the community, they might be working one-on-one, personal, delivery of personal
Yeah.
type care services. It could be in all types of homes, residential homes, or in actual participants' homes, and then also sites. So, what if you've got an organisation where that is doing a range of things, what would be a good way, I suppose, that they could, sort of take a bit of a bird's eye view of what's actually going on to identify those types of potential safety risks?
I guess there are obviously all the work safes and all the platforms do have really good checklists and workplace checklists. But essentially, what you want to be doing is, like you mentioned at the start, is doing a bit of a risk assessment on the whole process for what for your business or for what you do, and actually identifying where are my risks, and giving them a high, medium, low rating, and then starting to chip away at those high risk items and making sure that you have got appropriate controls in place to manage those risks. But incorporating the staff and consulting them as part of that process, I think, is key.
Absolutely. And it's also part of that safe environment provisions
Yeah.
too, where we actually need to, and also part of assessment where there is a requirement to actually link in and communicate with a participant in relation to those strategies and risks as well. So that's also important to link back. Moving away from people with disability, what about the staff, more so of those HR considerations and how that links to work health safety, such as bullying and things of that nature?
Yep. So I guess every business should establish those HR policies, such as, code of conduct, bullying policies, harassment, discrimination, alcohol and drug use, smoking, grievance, all those things. They are all part of safety as well. So HR forms a pretty critical part in terms of safety, and establishing policies and even some procedures around those areas are really important. Mental health, I think, is particularly important. And, over the last year, we've seen so much, I guess, attention around mental health, which has been awesome. But as a business, mental health is just as important as physical health. So there needs to be a focus on that area as well. And leading by example, like designating work to support mental health, shaping that positive culture in your workplace, managing the workplace factors that, that cause issues in terms of mental health, and having learning and support for your staff is so critical, I think, in this day and age.
Especially the providers that have maybe have, still that, hybrid model of some staff in the office, out of the
Yeah.
office and working from home. And yeah.
And I think that's going to be the case for a long time. I think we're going to stay hybrid. I don't see that changing. I think we're going to keep that mix personally.
Yeah, absolutely. Or just on that, you mentioned one thing I wanted to add in was social media as well. So use of social media. And I think this is also a safety consideration. Maybe in terms of risk management, I see it also at that high level of protecting reputation. And then also I see it at that lower level of actually protecting safety of your staff and participants as well. Is that something that you've started to see more in businesses, more organizations looking at what is that expectation on their staff and maybe contact with their clients after hours and things of that nature, and use of social media?
Yeah, it is interesting that has popped up definitely. We support clients in creating HR manuals, and part of it does include social media now. Well and truly, staff are being asked to sign off on against the requirements and what the expectations are in terms of social media. Definitely something that's been captured now by the workforce. I don't think you can live without that piece in, people need to have some sort of social media policy within their business and get staff to sign off against it.
Yeah, it's something I haven't seen too much out there when I've been auditing.
Okay.
And it's obviously, it's not a specific requirement, but I think in some cases, especially around, because I deliver a lot of incident management training, and a
Yeah.
lot of the issues that are coming through, and, you know, where there's, you know, people crossing the line and there's potential misconduct and breaches of the code of conduct, that's where I sort of start to see it slipping through there.
Okay.
But yeah, anyway. We've sort of talked about, you know, different types of delivering services and supports, you know, with community settings and participants' home. But what would be some of the different types of considerations in those areas, do you think, Hazel?
I guess, and a lot of these businesses have either workers or subcontractors supporting the community. So I
Yep.
think that subcontracting piece, you know, is something to look at.
Yeah.
But as you mentioned, I mean, when I went searching to sort of find what are the real big things that happen in this zone, it is that hazardous manual tasks such as, you know, moving people, lifting shopping, vacuuming, moving furniture, all those types of things. That is by far, I think, the biggest risk I saw when I did a bit of research. Obviously, there's things like slips, trips and falls, you know, uneven floor surfaces if you're in someone's home, loose rugs, pets, you know, electrical cords, you know, all of that. That obviously is something that needs to be looked at. And then there's that piece of isolated and remote work that I think is a risk for that zone. And behaviours like challenging and aggressive behaviours, that would definitely be a piece that needs to be covered by the risk management piece. But they're the big risk, you know, vehicle and driver safety, electrical safety. Those to me, and even when I did a bit of looking around, are the big hazards. From what I've read so far and what you've already talked about, it is so important to conduct a risk assessment prior to commencing any work in a new location. Given the type of work, it's so important to have a process where that is done and there is evidence of that being done. And then once you've done that risk assessment, obviously involving staff as part of that process, but then training staff, making sure staff know, you know, what are manual handling risks? How do I manage that? How do I deal with aggressive behaviour, for example? Having proper training for staff and making sure they're signing off against it too, so they're aware that, you know, I'm saying I understand this piece. I think that's really important, but also developing those processes around how do I report a hazard? You know, if I go somewhere and I spot something that's not quite right, making sure there is process for reporting any hazards that they spot, near misses, and obviously the incident management if there has been an incident. But I think the key across all of these is that communication and consultation piece, and making sure that your staff feel safe and feel like they've got an opportunity to be heard is a real big piece across all of these hazards that we've talked about.
Oh, I agree. Thank you for that. Let's go back to about where we've got staff working from home. So I know in Victoria especially, we've still got, and I've been blown away. Like, it's been so good to be back on site, I have to say.
Look, I'm enjoying. I know. Giving people a cuddle and stuff. I know we're not probably meant to be doing that, but you know, with clients.
Not quite. I'm the auditor, so I
know.
I think it would be a good look if I went in and started cuddling. I think they'd be like, "What are you doing?" I think there'd be a complaint. I'm just laughing. So yeah, it's been really good to be back out on site auditing. And, it really has. And then yesterday I was out with a provider, and because there's a lot of national organisations, you know, that are already used to tapping into Teams or whatever, you know, IT they're using, and people are just there straight away, and it's so good. So I really see there's so many benefits, and people are really still linked in. And it's been, you know, from an auditing point of view, even though I've been on site, if we've needed to then speak to like the national manager or someone, you know, from the executive team, or, you know, even staff members from all different, you know, parts and states, it's been really easy to tap in. But from a work health safety point of view, you know, what could there be some considerations for providers who still have you know, staff at home, you know, not always in the office, maybe they're not yet just made that back in. What are some of the things they should be looking at there?
So as an employer, you need to remember that you still have all those obligations, even if someone's working from home. So that is the key, like health and safety standards need to be there even at home. So I guess some of my tips, I think, in terms of that is making sure that you have a process of communication and making sure that you're constantly communicating with those that are working from home. I personally think that's number one. It is so critical that you still have those open lines of communication for mental health, for people feeling like they're part of the team. I think that's really important. And making sure that the safety standards in the workplace are now the same at home. So making sure desks are set up properly, people have the facilities and the capabilities to be able to work at a desk, or at least in a space that is considered safe and is obviously set up in a safe manner. Making sure people are aware of those working hours, because I know when I've been at home, it is hard and the hours do blur. So having that, people having a start and stop time.
Yeah.
And obviously I mentioned equipment. So making sure everything is set up in an ergonomic manner is critical. And then allocation of work, like you said, those Slack, Asanas, all those communication tools that have now popped up everywhere, they are really powerful, and I see them as a really great tool. I mean, even myself and our team, we use WhatsApp and we chat all the time and keep track of what we're each doing and those kinds of things. So we use that quite a bit. But I think the big piece, and from what I see now, is making sure that you do have some sort of working from home check for the staff members that are working from home. So a checklist that covers the requirements in terms of safety, how they've set up their desk, things like a first aid kit, all those types of things should be part of a working from home checklist. Having that done, but having also physical photos of what that work environment is something that one should do. But just to protect yourself as a business. So if someone is set up totally wrong, you can go, hey, do you need another screen? All those kinds of things. So for me, I think it's so critical that there is some sort of check that the employee's home setup does meet minimum requirements.
Yeah, absolutely. It's it can get a little bit
tricky,
I know, especially with large organizations. Like my little team, we're just small and we work remotely, and that's hard enough, to manage that. So yeah, I really feel if you're a big organization and that's been what's been happening, on your plate for especially the last 12 months in particular.
Yeah, definitely been a huge focus. Definitely.
Yeah,
absolutely.
But I have to say, like, I think I've been really blessed with the organisations I've been visiting lately. They seem to be doing that not too bad, actually, which is really good. A lot of work has gone into that, a lot of work, to set that up. So, now you've helped clients achieve, safety, ISO safety standard certification, and also, but even just sort of smaller systems as well to help people get their work health safety obligations on track. What are some of the common issues and risks that you've seen in some of the businesses you've been working in?
Okay, so I think I've mentioned a few of these. Consultation, so where they absolutely don't communicate well with their staff. So things like, having proper meetings, documenting those meetings, if there's any safety concerns, having some sort of mechanism to consult with staff and communicate with staff. Induction and training records by far is one thing we don't see managed well. So even things like first aid training, and the expiry of first aid training, how are you tracking that? Have you got evidence of someone having first aid training? All those kinds of things. Those training records, whilst people sometimes get the training done, we don't see a lot of the records that support that process. And then legal requirements and that total lack of just no knowledge of what the requirements are. Particularly, I think for that piece, that one, I think the websites like even the Safe Work Australia websites and even the regulatory bodies in each state have got incredible websites these days. I think by far everyone should be tapping into those websites, and I think we've got them as links in your presentation later. But emergency preparedness, things like, do you run drills? do you know where to go when there's an emergency? Those bits and pieces are definitely not covered well. And then just a lack of policies and procedures, and just no formal structure for people to even know what they need to be doing in a business. So I think they're the things we mostly work to fix pretty quick when someone's wanting us to help them with safety.
Yeah. And I have to say, I saw a post, I think it was on LinkedIn recently, Hazel, where you said something, you know, if you go into a business and you see that they're technically not doing something, you know, how you're non-judgmental about that. You're actually there to help. You're not a regulator. You're not there to audit.
No,
you're not there to report. You're not the police officer.
Far from it. Like, I had a call this week where there was a demolition company who had a site incident, a near miss, and I think it freaked out the owner a fair bit. And he's like, if you come here, will you tell WorkSafe? And I said, we're not here to tell WorkSafe. We're here to help you make sure you meet your legal compliance, and we'll work with you to get you to the point where you are compliant. That's what we're here for. We're here to work with you, not against you. Like, you know, the purpose of what we do and what we love to do is making sure people can go home and forget about, you know, the risks that are sitting at their site, because they know that they've done what they can to control and mitigate those risks. So that is definitely a zone, and definitely one we work quite closely with the business owners.
I thought that was a really good, you know, communication piece, because I would hate to think anyone's there at night needing help, you know, and they can't sleep and they're stressed, and they, you know, oh, who do I reach out to? But absolutely.
And so even this incident, you know, he was like, will you tell, you know, so there was that concern about, you know, will you tell, if you find something, will you tell WorkSafe? I was like, no, you know, that's not what we're here for.
Absolutely. No, I thought that was important to add. So what advice would you have for NDIS providers to make sure that they feel comfortable that they have identified all their work health safety matters and identified their risks in their business?
And I know I feel like I'm keep saying the same thing. So I guess provide safe work premises, you know, wherever people are working, make sure that their workplace is safe. Assess risks and implement controls. Make sure that you have got a process for not just identifying the risks, but what am I doing to control those risks, and making sure staff come along on that journey. Making sure that if you use any chemicals or anything like that, there is safe processes. Any machinery, equipment, maintenance, that's another key. And making sure that you have got processes defined for staff, you know, like your incident management. What happens when there is an incident? Do your staff know what they need to do? So develop those processes and train your staff, and provide everything you can for your staff members so that they can be safe. And I think they're the big piece. And obviously, consult, train and induct workers is key. And then making sure as a business you have insurances in place too, because we often see that that's not there, you know. So that's something to have as well as a business owner.
Absolutely. Yeah. I'm in the midst of, that's often tricky, especially when you're providers and they go through that verification and they don't understand exactly what insurances they need. So sometimes there can be a bit of time, and obviously, you know, I can't consult because I'm limiting that, but there's some really good information actually from the commission in relation to those types of, you know, very, very specific about what type of insurance. But obviously, if in doubt, you need to seek some sort of like legal advice, especially around, you know, product and liability and professional indemnity. So,
but I think the one thing is promote safety in your culture. I think that's really important. So commit to safety, you know, get involved with safety, encourage that participation. Like, we have clients, I just say to them, put safety in every meeting. Have it as an agenda item. Just make it part of your business, so even your staff know that safety is important to you. So that, I think, is really important. And then reviewing how you're performing. You know, do you have really a high amount of incidents? What are you doing about those? How you're learning from those incidents? All those kinds of things I think are critical. The culture that you build is really important in terms of safety.
That's it, because they're the type of questions I would ask from an auditing point of view, and obviously doing it just because auditing, but looking actually at the registers, you know, the types of incidents that are occurring with your staff. And I think education is so important. Like, still staff, when I go out on audit, they don't understand what a reportable incident is.
I see. Yeah.
Yeah, that's a huge risk for participants, people with disabilities access
Yeah.
services, as well as organisations, so at that higher level in terms of reputation, safety, all sorts of things. So all right, now before I ask you the last question, if anyone got any specific questions for Hazel, please ask away. Like I said earlier, even if you think there's no silly questions here, or if you wanted to, I will give you Hazel's contact details so you can email her too. But please feel free to pop it in the chat box or the Q&A. And I'll ask you this last question, Hazel. So what can Compliance Lab do for NDIS providers? What would you be able to do there?
So outside of obviously the ISO safety certification, we can help businesses with their safety legal compliance, establishing policies, processes, anything around that safety documentation, doing risk assessments, all those bits and pieces we can definitely help you with, and having systems to support that safety in your workplace. So it is where our passion lies too. So definitely we do work outside of that ISO space.
Yeah, absolutely. Cool, good. Well, if there's no more questions, there's no other questions. There's no more for me. Is there anything else you wanted to add? I'll just quickly share those resources that we've talked to today. I'll just quickly do a screen share. Bear with me. All right, so I'll just make this. Oh, is that the presentation button? There we are. Oh, that's all right. So we've got here Safe Work Australia. That's a really good website, isn't it, Hazel?
It is. By far, that's where I go the most. And then if you need to then branch out, it does even send you to the other websites in each of the states for the regulatory bodies for safety. Yeah.
Absolutely. Obviously, NDIS, we've got a little bit of information around coronavirus, but I think if you really want more information around coronavirus for the NDIS, Safe Work Australia is probably the one to go to. Then we've got the Australian Institute of Health and Safety.
They've got like news, they've got like safety resource links there, and they've also got like a monthly newsletter that comes out. So I find I sign up to all those safety ones because you do get some tips and tricks, and you find out what's been happening in the workplace. I think that they're really great resources to be getting on a regular basis.
Yep. And what we've got here, business. That's a really great website, by the way.
Oh, that is fantastic. Yeah, it is fantastic. There's a HR manual there. In there, for example, that covers all the legal requirements in one manual and even has a sign off. It does include those social media bits and pieces that you talked about. So I find that website absolutely awesome. So that is really good. And then there's even the business government website, which does have things around risk management, health and safety. But there's so much wealth of knowledge in in the government resources is really good.
Absolutely. So what I'll do is I did try, for some reason I can't share the PDF in the chat box. It won't let me do that on the webinar. I'll email you a copy of these slides, so they'll have those resources there if you wanted to follow up with them. So this is who we are. This is how you can connect with us. Please connect with us on LinkedIn. Looks like we've got one chat message there. This is from Christopher. With the HR templates, is that also relevant, applicable for other state legislations?
Yes, I would imagine it is, but I would get that double checked. It is Victorian based, so it does cover, I guess, the Victorian legislation, but a lot of it in terms of HR would be similar across all the states. So it is definitely a really great tool. We love it in our zone. Where clients don't have a HR manual, we well and truly direct them to it. It's a great resource.
And you would do research, Hazel, wouldn't you? If you've got
Queensland. That's right.
Yep.
Yep. So we do have a few clients in Sydney, and yes, we'd make sure that HR manual gets molded to suit. But if you want to, if you're looking for it yourself, Christopher, I'd recommend look at it, but also check what your legislation also covers as well, and make sure that you're ticking those boxes.
Yeah, no worries. Well, good. Well, thanks very much, Hazel, for you giving up your time today, and I really appreciate that. So as I said earlier, there will be a replay available on our YouTube channel. It sounds like, we're all YouTubing. That's not really, it's pretty boring. but this is where I upload all the webinars. So please feel free to share this with your colleagues. You will receive an email from me, I'd say in the next 24 hours, because I've got a bit of work on and I'm running an incident management course starting at midday. So I've got to get my skates on, but you will get an email with a PDF copy of this, with those resources, and where you can find the replay to this webinar. So thanks very much for everyone turning up. If you'd like a certificate of attendance for your HR records, email me, let me know, and I can, we'll have one knocked up for you earlier next week. So if there's no other questions, we'll end it there. Thank you so much, Hazel.
Thank you. Thank you. Thanks for having me, Lauren.
No, and thank you. And thanks for all the content that you keep putting out there. It's just, I really appreciate it. I know from a business perspective, and I know how much your clients really appreciate it too. So thanks, Hazel.
Thank you. I appreciate all your support. You're always there.
Thank you, everyone.
Thank you.
Really great to see some of you again. And I really appreciate it. Not a drama, Christopher. Thanks so much.
Thanks, Christopher.
Great. And also too, if you've got any requests, we've got risk management next month. I have managed to snag someone from a certification body I work with, HDAA, to talk about things about audit. So if you've got any issues at all, non-conformances, audit scheduling, communications with your auditor, how to deal with difficult auditors, whatever you want to talk about, please send me your questions, send me your suggestions. And I'm here to be of service to the NDIS sector. So take care, everyone, and stay well. Thank you.
Thank you. Thank you.
Thank you.